Hi, I'm Dr. Eli Whitney at the Heart and Vascular Institute of Texas. I'm here to talk about Crestor. This important statin medication not only significantly lowers cholesterol, but it also reduces the risk for heart attack, stroke, blood clots in the legs, blood clots in the lung, and death. Many of my patients tell me length of life is important, but equally, if not more important, is the day-to-day quality of their lives. That's why practicing preventive medicine is so important. Crestor is the most powerful statin medication currently available. It works by increasing the uptake of the bad LDL cholesterol from the blood so the liver can safely remove it from the body, instead of leaving it to clog up in the walls of the arteries feeding the heart, brain, and possibly do this. In addition, Crestor is the most effective statin in raising the good HDL cholesterol. It would be a mistake to believe that just taking this medication means you can go back to unhealthy, high-fat diets. Don't believe it. Diet, exercise, and smoking cessation are still very important in reducing the risk of heart attack and stroke. Medicine alone will not stop the disease process. Crestor was proven in 2009 when the Jupiter clinical trial study was published. This huge study involved over 11,000 men over the age of 50 and 6,800 women over the age of 60. These men and women were in good health as part of the criteria to be in the study. None of these patients had a history of diabetes or a history of cardiovascular disease. In addition, they all had to have cholesterol levels that were so low that no physician would want to treat them with a cholesterol-lowering medication. The average LDL cholesterol in the patients was only 108. When the study began, all these patients were split into two groups. One group received a placebo, a pill made of cornstarch which has no effect. The other group received Crestor 20 milligrams per day. By the time the study ended, the Crestor group saw the LDL cholesterol levels fall dramatically, on average down to 55 milligrams per cent from the original levels of 108 milligrams per cent. But in the group who received the placebo, LDL cholesterol levels remained at the original 108 milligram per cent level. But there were other positive effects of Crestor than just the reduction in LDL cholesterol levels. Heart attacks were reduced 54%, strokes were reduced 47%, need for bypass surgery or angioplasty was reduced 47%, and all causes of death were reduced 21%. Blood clots in the legs and lungs were reduced by 43%. Because of the tremendous positive benefits from Crestor, the study was stopped after only 1.9 years. When such overwhelming results occur in such a short period of time, it's medically unethical to continue giving patients the placebo. Crestor was very well tolerated. Only 6% of the patients on Crestor stopped the study due to side effects. 5% of the placebo group stopped the placebo due to side effects. The full dose of Crestor is 40 milligrams per day. There was a single study using the full dose of Crestor, 40 milligrams per day, on patients who had blocked arteries to the brain. After just 2.5 years of therapy, the average blockages in the neck arteries actually improved in the treated group, but got worse in the group that got the placebo. I hope this brief educational video has helped you better understand the value of Crestor and why I've prescribed it for you. You may feel fine right now, and I want you to stay that way. How long do you have to take Crestor? You do not have to take Crestor for the rest of your life. You can stop it when you are 95 years old or when you no longer want to have a heart attack, stroke, or die. This is Dr. Eli Whitney with the Heart and Vascular Institute of Texas.